What are birthmarks? Birthmarks are benign, colored marks or spots on the skin that appear at birth or shortly after. They can vary in size, shape, and color. Causes of birthmarks. The exact cause is often unknown, but is believed to involve genetic factors, abnormal development of blood vessels, or excess skin pigmentation during fetal development. Types of birthmarks. Vascular birthmarks, hemangiomas, raised red marks that often shrink with age. Port wine stains, flat, red-purple marks that don't fade and may require laser treatment. Salmon patches, light pink marks that fade by the age of 2. 2. Pigmented birthmarks, moles, congenital nevi, brown or black marks that may require monitoring for changes. Sun, café au lait. Spots, light brown marks that generally don't require treatment, but may indicate genetic conditions if there are many. Mongolian spots, bluish-gray marks common in darker-skinned babies that fade with time. Treatment options. 1. Observation. Many birthmarks, especially salmon patches and Mongolian spots, fade naturally over time and require no treatment. 2. Medications, beta blockers, propranolol, used for hemangiomas to shrink the blood vessels and reduce the size of the birthmark. Steroids can be applied topically or injected to shrink vascular birthmarks like hemangiomas. 3. Laser therapy. 1. Effective for port wine stains and some hemangiomas, using lasers to shrink blood vessels and reduce the appearance of the birthmark. Port wine stains, typically 3 to 5 sessions spaced 4 to 6 weeks apart. Hemangiomas, generally 2 to 6 sessions with a session every month. Pigmented birthmarks, moles, café au lait spots, usually 2 to 4 sessions spaced 4 to 6 weeks apart. Other vascular birthmarks, typically 2-5 sessions spaced 4 to 6 weeks apart. The number of sessions required depends on the size, color, and location of the birthmark, as well as skin type. Multiple sessions are often necessary for optimal results. 4. Surgical removal used for moles, if cancerous or problematic, or large birthmarks that cause discomfort or functional issues. It involves excising the birthmark and may include a biopsy. 5. Cryotherapy, freezing. Liquid nitrogen is used to freeze and destroy the tissue of moles or pigmented birthmarks. 6. Cosmetic treatments, makeup, used to cover birthmarks for cosmetic purposes. Tattooing, micropigmentation, can be used to conceal stable pigmented birthmarks. 7. Dermabrasion and chemical peeled. Dermabrasion removes the top layer of skin, and chemical peels exfoliate the skin to reduce rough or pigmented birthmarks. 8. Monitoring moles should be monitored for changes in size, shape, or color, which could indicate a need for further medical evaluation. When to seek medical help. Consult a healthcare provider if a birthmark changes in size, color, or shape, causes discomfort, or affects vision or breathing. Most birthmarks are harmless and fade over time, but some may require treatment or monitoring. For those seeking professional treatment for birthmarks, you can visit Milo Dermatology and Aesthetic Center for expert advice and personalized care options.